When Cape Fear Valley Medical Center opened its doors 50 years ago, it was a small 200-bed community hospital in an isolated rural area of Cumberland County. Some citizens questioned the wisdom of building in such a remote, inaccessible location. Today, Cape Fear Valley Health System is a bustling 616-bed regional health system serving a 6-county area of southeastern North Carolina. Located along a major 6-lane thoroughfare, it serves more than 600,000 residents of the Cape Fear region, providing tertiary medical services ranging from cancer care to open-heart surgery. Local resident John Sandrock generously donated the property for the hospital, the site of the former Sandrock Airport. He stipulated that the 29-acre site must be used for a public hospital, or else it would revert to his heirs. Portions of the remote property were covered with oak trees and sand spurs, and it was accessible only by a wagon road, until an adjacent property owner allowed a new access road to be built. That road would later become Owen Drive, and one of our county's busiest thoroughfares. Wilbur Clark, who served as treasurer for the original hospital board, remembers what the area was like.
It was just weeds, sand spurs.
It was just farmland.
It was just land. No, nothing there.
On June 8, 1956, the new hospital opened to the public. 3 days later, the first patient, Ava Ray Monroe, was admitted, accompanied by her physician, Duncan Shaw Owen, for whom the hospital chapel is named today. Ava Ray, who still lives in Fayetteville, vividly recalls that moment as though it were yesterday.
Everybody was very nice, very cordial, and I guess they were in the kitchen. They were doing meals for one that day, but it was pleasant memories.
When it opened, the hospital had a staff of 40 nurses and 50 non-professional nursing personnel. The business office employed a staff of 5. 3 employees worked in maintenance, and a single pharmacist served the entire facility. Janie McFadden, one of the employees on duty the day the hospital opened, still works at Cape Fear Valley today. She recalls what the new facility was like.
Looked like a big empty house. There were no charts, no furniture, no drapes, no linens, no medicines. There was nothing, so we had to get all that stuff in for it to be opened.
Over the next decade, Cape Fear Valley grew to keep pace with the growing demand for hospital care. A large expansion began in 1966 to add 195 private rooms with private baths in the 6-story South Tower. In 1971, the Cumberland County Hospital System Incorporated was created to oversee hospital operations. 5 years later, Cape Fear Valley opened Southeastern Regional Rehabilitation Center. The gleaming new facility was a 60-bed rehabilitation center, originally part of a statewide network of 6 regional facilities. In 1978, county voters approved bonds to pay for construction of a radiation therapy department, which opened in 1982. It was the start of our modern-day cancer center, which serves a 15-county area and provides more radiation treatments daily than larger facilities such as UNC. In 1985, Cape Fear Valley began its home health agency. A year later, the hospital opened its Level 3 neonatal intensive care unit, which provides the highest level of neonatal care possible. In 1987, the Cardiac Catheterization Laboratory opened, the precursor to the start of open heart surgery 5 years later. In 1988, Cape Fear Valley dedicated its new cancer center with the reigning Miss America in attendance. The following year, a new emergency department opened to the public. Visitors marveled at the spacious new facility, which was more than twice the size of the old ER. A major expansion in 1991 added 2 more floors to the South Tower with 68 more beds. 2 years later, construction was completed on the most ambitious project in the hospital's history, a new 4-story patient services tower. Like the community it serves, the health system continued to grow throughout the 1990s. Cape Fear Valley purchased Cumberland Hospital, a 175-bed psychiatric hospital, in 1993. A year later, the health system assumed Cumberland County's emergency medical services. During the decade, Cape Fear Valley also added 12 primary care physician practices to help alleviate pressure on the emergency department. 4 specialty practices were also added, including an OB/GYN residency program, a geriatric practice, a diabetes center, and an infectious disease practice. In 1998, the health system opened its chest pain center, expanded its neonatal intensive care unit, and opened a new cancer center. A 7-bed pediatric intensive care unit also began operating that year. In May 1999, Highsmith Rainey Memorial Hospital rejoined the Cape Fear Valley family after 16 years in private hands. And a year later, the health system opened its gleaming new HealthPlex Wellness Center, Fayetteville's first medically oriented fitness facility. Today, Cape Fear Valley Health System is the state's 11th largest health system. With more than 4,000 employees, we are the county's largest non-governmental employer and a significant driver of the local economy. Our payroll alone has an estimated economic impact of $472 million annually. The health system has not received any local tax subsidy since the mid-1970s and contributes to our community in many other ways. Through the Medication Access Program, we help provide $6 million annually in free medications to those in need. We help provide free follow-up care for patients seen at the Care Clinic, and we will provide an estimated $87.5 million in uncompensated care to indigents and others who don't pay their hospital bills this year. Through the Southern Regional Area Health Education Center, we provide $2.4 million in annual support for the Family Medicine Residency Program. We also subsidize Cumberland County EMS with $3 million annually. Our 24-hour nurse call center, CareLink, handles nearly 400,000 phone calls from the community each year. Today, Cape Fear Valley ranks in the top 5% nationally in vascular care. We are among the top 20% of hospitals nationwide in employee satisfaction. Through the Hospital Quality Initiative of Medicare, we routinely rate in the top 10% nationally for orthopedic and heart care. Our Rehabilitation Center rates in the top 10% for patient outcomes among more than 800 facilities across the nation. Now, the health system is embarking on its most significant expansion yet. Construction is underway on Valley Pavilion, a 6-story patient tower. Scheduled for completion in 2008, it will provide 100 new hospital beds, with a new heart and vascular center and a new emergency department. Also included is a new 500-space parking deck. In the meantime, Highsmith Rainey has been converted to a long-term acute care hospital to care for patients who are too sick for placement into nursing homes or rehab facilities. Its emergency department has been converted to an urgent care facility to provide prompt care for those with minor injuries and illnesses. To help plan for its future, Cape Fear Valley has also changed its organizational structure. Thanks to the wisdom and foresight of our Board of Trustees and County Commissioners, Cape Fear Valley has changed to a community-owned, not-for-profit health system. This new structure will provide improved flexibility in investments, financing, and operations so that we can provide needed healthcare services in the future. At its heart, though, Cape Fear Valley will remain our community's health system. Our mission will remain the same, to serve everyone who needs help. The same corporation that has operated Cape Fear Valley for the past 35 years will still run the health system, and your friends and neighbors will continue to serve on our Board of Trustees. Your elected county commissioners will remain on the board as well to further assure public accountability and trust. We will still be your community's health system, serving you and your family's health care needs for the next 50 years.